हेलो दोस्तों। तो वेलकम टू माय चैनल नर्सेस गोल। और मैं आज पोजीशन का असाइनमेंट बता रही हूँ आप लोगों को। तो आइए देखते हैं। इंट्रोडक्शन। Position used to comfort are one of important aspect in nursing intervention. Nursing caring for client in many setting and situation can adapt various comfortable position to provide them a comfortable stay. Patients' ability to assume position depend upon their physical strength and degree of wellness. Next definition. Positioning is defined as placing the person in such a way to perform therapeutic intervention to promote the health of an individual. Next definition. Position defined as placing the person in a proper body alignment for the purpose of preventive, promotive, curative and rehabilitative aspects of health. Purpose of positioning: to provide comfort to the patient, to relieve pressure of various parts, to improve circulation, to prevent formation of deformity, to prevent pressure sore, to provide proper body alignment, to conduct delivery labor, to carry out nursing intervention. Now the types of position used: dorsal position, second dorsal recoupment position, lithotomy position, lateral position, prone position, Sims position, knee chest position, Trendelenburg position, Fowler position. Types of patient need special care: unconscious patient, infant and children, hemiplegic, paraplegic patient, immediate post-operative patient, orthopedic patient, cardiac patient. प्राइमरी असेसमेंट, तो मतलब जो हम लोग प्राइमरी असेसमेंट करेंगे पोजीशन के, जिस पेशेंट को पोजीशन देना है उनमें, ओके। चेक द पेशेंट जनरल कंडीशन, चेक द फिजिकल ऑर्डर फॉर एनी लिमिटेड मूवमेंट, assess the self-care ability of an individual, arrange the comfort device near the bedside, identify the deformed extremity, support the immobilized area during positioning, identify the rationale before positioning. Now procedure: explain the procedure to the patient, provide privacy, arrange the articles and manpower. Unity the bed seats, turn, lift, ambulate gently, place and support with extra pillow and pressure point, special care taken at pressure area, covered the patient with top sheet and hand wash. Now अब हम लोग देखेंगे फर्स्ट पोजीशन जो है कि डॉर्सल पोजीशन, जिसको हम लोग सुपाइन पोजीशन भी बोलते हैं. सो सुपाइन पोजीशन, द पेशेंट लाई ऑन हिज बैक विथ हिज हेड एंड शोल्डर आर स्लाइटली एलिवेटेड. ऑन one pillow is given under the head. His leg should be slightly flexed. A small pillow is placed under his knee. So now it's indication. The usual position used by the patient, used for examination for the chest and abdomen. Procedure of dorsal position: place the patient on back with one pillow under the head, arm and hand at the sides, knee flexed and separated. Align the patient body in good position. Support the body part in good alignment for comfort when the patient is paralyzed. Place the air ring with the hip under place the air ring under the hip and cotton ring or foam pad under the heels to reduce pressure. Contraindication: elderly patient, patient with operation on abdomen, breast and thorax, prone to hypostatic pneumonia, patient with long standing illness and neurological condition. So this is supine position और डॉर्सल पोजीशन. ओके, नाउ अब हम लोग देखेंगे डॉर्सल रिकूपमेंट पोजीशन. A position in which the patient lie on the back with lower extremity moderately flexed and rotated outer. Now हम लोग देखेंगे dorsal recumbent position, a position in which the patient lie on the back with lower extremity moderately flexed and rotate outer. Indication: it is used for catheterization, vaginal touch, vulval, vaginal and rectal examination. It is also used for vaginal operation and insertion of tampon. Patients who are in the convalescent period, patient with gastric condition, patient with abdominal or pelvic operation unless erect sitting position is indicated. Procedure: place the patient on back in bed with two or more pillow under the head and one pillow under the knees, or maintain his position by elevating the top of bed on blocks. Align the patient's body in good position. Support the body parts in good alignment for comfort when the patient is paralyzed. So this is dorsal recumbent position. Now third is lithotomy position. The patient lie on her back, the legs are separated and thigh are flexed on the abdomen and the legs are on the thigh. The patient buttock are kept the edge of the table and legs are supported by strips. Indication: this position is given during gynecological examination, treatment and operation, and uh, janit- janitouria system for delivery of baby, for rectal examination and operation. Procedure: explain the procedure to the patient, provide privacy, position the patient to lie on his back with one pillow under the head. Keep the leg well separated and the thigh are well flexed on the abdomen and the leg on the thigh. Buttock are kept on the edge of table and the leg are supported on strip. Contraindication: contraindication of this position are patient with arthritis or joint deformity may be unable to assume this position. So this is lithotomy position. Now, prone position. A position in which the person lies flat with the chest down and the back up, straight position. This position is maintained by using pillow. Indication: this position used post-operatively to prevent aspiration of saliva and mucus. Used in post-operative cases, tonsil, vesico-vaginal fistula and spinal cases. To prevent bed sore, to relieve abdominal distension, used for patient having injuries and burn on back. Procedure: explain the procedure to the patient, provide privacy, place the patient flat on abdomen with one pillow under the head, turn patient head on one side and align the patient in good position. Support the body parts in good alignment for comfort. Place both arm lie at the side of head. Contraindication: this position is not well tolerated by the elderly or patient with cardiovascular or respiratory problem. So this is prone position. Now lateral position. Patient lie on left side with leg flexed at thighs. A patient is kept in front of abdomen and the back and um, one under the upper leg. Indication: lateral position is used for giving back care, enemas, and colonic irrigation. Used for examination or perineum or rectal insertion, suppositories for taking rectal temperature for changes of position. Lateral position is a relaxing position giving back care. Procedure: explain the procedure to the patient, provide privacy. For left lateral position, place the patient on the left side with buttock to the edge of bed, both thigh flexed and left arm underneath. For right lateral position, place the patient on right side with buttock to the edge of the bed, both thighs flexed and right arm underneath. Align the patient in good position and make sure the patient is not lying on his arm. Support the body path in good alignment for comfort. So this is lateral position. Now Sims position. Sims position is similar to the lateral position. The patient with the patient weight is on the anterior aspect of patient's shoulder, girdle and hip. Indication: this position is used for unconscious patient. It is used for rectal examination, used for vaginal examination, used for relaxation and ant- antenatal exercise. Procedure: explain the procedure to the patient, collect article need to the bedside, provide privacy, place the patient on the side. One pillow is under the head with the left cheeks resting on it. The left arm is drawn behind the body and the right arm may be in any position comfortable for the patient. The right thigh is flexed against the abdomen. The left thigh is extended well. Cover the patient with the top sheet neatly. Contraindication: patient with deformity of hip or knee may be unable to assume this position. So this is a Sims position. Now knee chest position, or it is also called genupectoral position. Patient rests on the knee and the chest. The head is turned to one side with one cheek on pillow. A pillow is placed under the chest. The weight it on the chest and knee. Indication: this position is under used for sigmoidoscopy, used for vaginal and rectal examination, used in first aid treatment in cord prolapse or uterus, an exercise for postpartum and gynecology patient. Procedure: explain the procedure to the patient, collect the needed article at the bedside, provide privacy, make the patient rest on the knees and chest. The head is turned to one side with the cheek on a pillow. The arm should be extended on the bed and flexed at the elbow. To support the patient partially, the patient should rest on the chest and knees, which are flexed so that the thigh are at right angle to the legs. Contraindication: the patient with cardiovascular and respiratory problem cannot assume this position. So this is chest position. So eight, um, Trendelenburg position. The patient lie on his back. The patient head is low. The foot of the bed is at 45-degree angle. Indication: used is emergency situation like shock and hemorrhage. This position is used for vaginal surgeries, used to displace intestine from pelvic cavity, upper abdomen, used during operation of the pelvic organ, you to arrest bleeding from lower limb. Procedure: Explain the procedure to the patient, arrange the article needed to the bedside, provide privacy if needed. Place the patient laid on his back, elevate the foot and at 45-degree angle. The body is on an inclined plane with hip higher than the bed. The knee are flexed and the leg hang downward the end of the table. The patient is carefully supported to prevent sleeping. To prevent sleeping. Dropping down depend upon the kind of operation to be performed. So this is trend Lindbergh position. Now it's Fowler position. Fowler position is a sitting position in which the head is elevated at least a 45-degree angle. The back rest and two pillow are used for the back and head. Indication: to relieve dyspnea, to improve circulation, to prevent thrombosis, operatively to assist drainage from abdominal or pelvic cavity, to relax the muscles of the abdomen and back and thighs, to relieve tension on the uh, abdominal suture, to promote comfort, to localize infection, to relieve edema of the chest and abdomen. Procedure: explain the procedure to the patient, arrange the article needed at the bedside, provide privacy, place the patient in sitting position with arm at the sides and knee raised with pillow, maintain the position elevated the head of bed to 45 to 60-degree angle, semi Fowler or 60 to 90-degree angle at high Fowler. Elevate the knee rest to an angle of 15 degree or place a small under the knee. So this is Fowler position.